Introduction. Your body is talking. Are you listening? Most men don't realize it, but one of the earliest warnings your body gives when something is wrong isn't chest pain, dizziness, or fatigue. It's your penis. Yes, you read that right. Changes. In your erections, whether it's less firmness, fewer morning responses, or just a sense that something's off, are often your body's first quiet signal that deeper issues may be developing. And yet so many men shrug it off, chalking it up to age, stress, or just life. But what if that small sign was actually the beginning of something bigger? What if it was your body's way of asking for help before the heart attack, the hormone crash, or the irreversible decline? I'm Dr. James Rowen, a board-certified urologist who has spent over 40 years helping men reclaim not only their sexual health, but their sense of confidence, strength, and control. And today, I want to share with you the 10 things you should never do to your penis after 60. These aren't scare tactics. They're real stories from real patients, fathers, veterans, grandfathers, who waited too long, made the wrong assumptions, or simply didn't know better. And my mission is to make sure you're not one of them. This article is not just about sex. It's about health, about identity, about living the final chapters of your life with clarity, vitality, and dignity. So if you're a man over 60, or you love one, stay with me. What you'll learn could save your confidence, your marriage, and maybe even your life. And if you want more honest, science-backed, no-nonsense advice on aging well, living strong, and staying connected to your best self, hit that follow button and join our growing community of men who refuse to fade quietly. Now let's begin, because your body is talking, and today you're going to listen. Never ignore your erections. They're a signal, not just a symptom. It's a line. I've repeated to thousands of patients, your penis is not just about sex, it's a barometer of your overall health. Many men laugh awkwardly when I say that. Some even roll their eyes. But the truth behind that statement is no joke. When you were younger, your body could compensate. Poor diet, stressful job, not enough sleep, your system could still deliver when needed. But after 60, the margin for error shrinks. Erection issues. Whether it's difficulty getting hard, staying hard, or even morning erections becoming less frequent, often point to vascular trouble, hormonal imbalances, or nerve dysfunction. Let me put it another way. When your penis stops working like it used to, it's often the first alarm bell of a deeper medical issue. And the data backs this up. Numerous studies, including those from the Mayo Clinic and the British Medical Journal, have found that erectile dysfunction, ED, can precede a heart attack by 3 to 5 years. That's right. Your penis may be sounding the alarm about your heart long before your chest ever tightens. I remember a patient named Walter, a 71-year-old grandfather of 5. He came to me for a routine checkup and hesitantly mentioned that he hadn't had a full erection in months. I guess I'm just getting old, he said. But something about the way he said it made me run a few more tests. It turned out Walter had undiagnosed type 2 diabetes and early signs of coronary artery disease. We got him on treatment, cleaned up his diet, and within 6 months, not only was his glucose under control, he was also enjoying intimacy with his wife again for the first time in years. So no, your penis isn't lying to you. It's speaking up. The question is, are you listening? If you're consistently noticing changes, less responsiveness, weaker erections, fewer spontaneous events, it's not just about ego. It's about circulation, testosterone, nervous system health, and yes, emotional well-being. All these systems converge in sexual function, and here's the good news. Early action can change everything. Not just for your sex life, but for your heart, your brain, and your future. If something feels off, don't ignore it. Don't hide it. Get checked. Ask questions. Because sometimes, the smallest change in the bedroom is the loudest cry from your body for help. 2. Never use unproven devices or DIY remedies. Quick fixes can leave lifelong damage. We live in a world where quick fixes are sold in flashy packages. One click, and the internet offers pills, oils, gels, pumps, and secret techniques that promise overnight results. And I get it. You're frustrated. You miss how things used to work. The thought of asking for help can feel uncomfortable or even embarrassing. So you stay up late scrolling, looking for hope. But I need to tell you something. Man to man, what you're hoping will help may end up harming you. Over the years, I've treated too many men whose well-meaning attempts to solve their problems led to bruises, nerve damage, disfigurement, and long-term erectile dysfunction. One patient in his late 60s used a cheap vacuum erection device he found online. He followed vague instructions from a YouTube video, used it too long, and didn't release pressure in time. By the time he came to me, his tissue was swollen, dark, and losing circulation. We did our best, but he lost partial function permanently. Another
case involved gelking, a stretching technique widely promoted online as a way to increase size. In reality, this practice can tear the tunica albuginea, a critical layer of tissue surrounding the erectile chambers. I've seen the aftermath: scar,
tissue, painful erections, loss of sensitivity, and a deep sense of shame. These men weren't reckless. They were desperate. They just didn't know what else to do. The truth is, there is no magic shortcut to restore function, no ancient herb, no miracle device, and anyone who tells you otherwise is preying on your vulnerability. If you're experiencing ED or changes in performance, you need a proper evaluation. Blood tests, vascular assessments, hormone panels. These tools help us identify what's really going on, and more importantly, how to treat it safely. Sexual health is deeply personal, yes, but it's also deeply medical. You wouldn't treat heart problems with a DIY kit from the internet. So why risk one of the most sensitive parts of your body? You deserve care, you deserve real answers, and you deserve a future where you're not afraid of causing harm just by trying to feel alive again. Never skip hygiene, but don't overdo it either. It's a subject many men don't like to talk about. But we need to, because when it comes to hygiene, both too little and too much can lead to serious problems. First, let's talk about undercleaning. If you're uncircumcised and not pulling the foreskin back to clean underneath regularly, you're allowing smegma, a mix of dead skin cells, oils, and bacteria, to build up. This can cause balanitis, a painful inflammation that makes retraction difficult, leads to itching or swelling, and in severe cases, scarring that may require surgical correction. But just as dangerous is the other extreme: overcleaning. 1. Patient of mine, Bill, a retired cross-country truck driver, came in with a red, raw rash on his penis. I scrub it every day, Doc. Twice, actually. I thought it was good hygiene. Turns out he was using strong, scented soaps and even a washcloth to scrub his skin. What he didn't realize is that the penile skin is delicate. When you strip away natural oils with harsh chemicals or physical friction, you compromise its protective barrier, leaving it open to irritation, micro-tears, fungal infections, and worse. So what's the balance? Here's what I tell my patients. Use warm water and a mild, unscented soap. Clean gently, especially under the foreskin if uncircumcised. Pat dry with a soft towel. Don't rub. Clean once a day. Not more, unless advised for a medical reason. And above all, inspect yourself. Know what your body normally looks and feels like. That way, if something changes, redness, swelling, bumps, sores, or unusual discharge, you'll notice early. Many men don't detect problems because they never look. Hygiene is more than a routine. It's a daily act of respect for your body and your health. Don't treat this part of your body like an afterthought. Treat it like something worth protecting, because it is. Never dismiss pain, bumps, or bleeding. Your body is waving a red flag. There's a certain pride that comes with being a man, especially as we get older. We've endured hardship, pushed through injuries, worked without complaint. We've learned to tough it out. But when it comes to your penis, that mentality can become dangerous. Over the years, I've seen too many cases where men ignored small issues, an unusual bump, a persistent sore, a bit of blood in the urine, until it became something far more serious. Why? Embarrassment, fear, denial. But let me be clear. Pain, sores, bleeding, or changes in appearance should never be ignored. I'll never forget a patient named Harold, 68 years old. His wife practically dragged him into my office. He had a small lesion on the head of his penis, painless at first, so he waited. It slowly grew, and when he finally sought help, it had progressed into late-stage penile cancer. We saved his life, but not without aggressive surgery that left him deeply changed, physically and emotionally. This is what I want to prevent for you, because not every sore means cancer. In fact, in most cases, it's not. It could be a fungal infection, an STI, or inflammation from friction or hygiene imbalance. But regardless of cause, the earlier we see it, the better your outcome will be. Men also often ignore blood in the urine or pain during ejaculation. These symptoms can point to kidney stones, prostatitis, urethral strictures, or even bladder cancer. You are not being dramatic by coming in early. You are being wise. And if you're ever afraid of being judged, let me reassure you, no good doctor will ever make you feel ashamed. We are here to help, not to humiliate. The sooner you speak up, the more choices you have, and the greater your chances of a simple solution. So don't wait until the pain is unbearable. Don't wait until your partner notices something's wrong. And don't let fear be louder than your intuition. Your body is waving a red flag. It's time to act. Never have rough or uncontrolled sex. You're not 25, and that's okay. Let me tell you something few people will say out loud. Your penis, especially after 60, is not invincible. I know that sounds obvious, but be surprised how often men, especially those getting back into dating or intimacy after a long time, try to perform like they did at 25. The result? Pain, injury, and in some cases, emergency room visits. One of the most alarming injuries I see is the penile fracture. No, there's no bone. But when an erect penis bends violently, the tunica albuginea, the fibrous sheath surrounding erectile chambers, can rupture with an audible pop. I once treated a 64-year-old widower who had recently started dating. Again. The first time things got passionate, he felt that pop, followed by immediate bruising and swelling. His penis turned purple and bent, what we call the eggplant deformity. He was terrified and embarrassed. We had to operate quickly to prevent permanent damage. Sex after 60 should be fulfilling, not frightening. But it has to be adapted to the reality of your current body. That means using lubrication to reduce friction and injury, communicating openly with your partner about comfort, pace, and position, avoiding risky positions that create too much angle or pressure, slowing down and focusing on connection rather than performance. Intimacy at this stage of life is not about proving something. It's about sharing something. And the most satisfying encounters come from safety, trust, and being fully present, not reenacting youthful conquests. So no, you're not 25. But with care and awareness, your sex life at 65 or 75 can still be deeply passionate, emotionally fulfilling, and physically safe. Never overheat your testicles. Temperature matters more than you think. When we think about fertility and testosterone, most men focus on pills, exercise, or diet. But there's one subtle, often overlooked factor that plays a massive role in male hormone health: temperature. That's right. Heat is the enemy of your testicles. Unlike the rest of your body, your testicles hang outside your torso for a reason. They need to be cooler, about 2 to 4 degrees Fahrenheit cooler to be exact, for optimal function. That cooler temperature allows for healthy sperm production and keeps testosterone manufacturing running smoothly. Unfortunately, modern life works against this natural design. Every day, men sit for hours with laptops on their lap, radiating warmth, directly to the groin, heated car seats, especially in winter, tight underwear or synthetic fabrics that trap heat, and even prolonged hot baths or saunas. I treated a 68-year-old retired teacher who complained of low energy, decreased libido, and brain fog. He assumed it was just normal aging, but blood tests revealed abnormally low testosterone. After ruling out major causes, we discovered a daily habit: 2 hours each night soaking in a hot tub, followed by watching Netflix with a laptop on his thighs. Once he adjusted those habits, switched to looser underwear, limited hot soaks, and used a lap desk, his hormone levels improved naturally over time. The takeaway? It's not about living in an ice bath, but being mindful of heat exposure can help maintain hormone balance, sperm quality, yes, even if you're not trying to conceive, and sexual function. Here's what I recommend. Choose breathable cotton. Underwear. Avoid tight-fitting pants for long periods. Use a pillow or cooling pad under laptops. Limit time in hot tubs and saunas. Take breaks from sitting every hour to let things breathe. It's a small shift, but over time, it protects one of your most vital systems and helps keep your sexual engine running smoother for years to come. Never use a tight or aggressive grip. During masturbation, you're training your body the wrong way. This is a conversation that rarely happens, even between doctor and patient. It's awkward, it's private, but it's essential, especially for men over 60 who are experiencing changes in sexual sensation. Let's be honest, most men don't think much about how they masturbate. It's a habit, something done quickly, often in secret, and usually without much awareness. But the truth is, how you stimulate yourself can drastically shape how your body responds to intimacy and how it doesn't. One of my patients, Robert, age 72, had been divorced for years. When he started dating again, he found himself frustrated. "I can get hard sometimes," he told me, "but I can't feel anything. And with a partner, it's like I'm disconnected." After some digging, the problem became clear. For decades, Robert had used a very tight, fast grip during masturbation. That intense stimulation trained his nerves and brain to respond only to that kind of friction, not to the softer, warmer, more varied sensations of partnered sex. We call this phenomenon the death grip, and it's more common than you'd think. What's happening is simple but serious. When your nervous system is exposed to the same intense pattern over and over, it becomes desensitized to other types of touch. That leads to numbness, difficulty, climaxing with a partner, and even a kind of mental detachment from the act of intimacy. So what can you do? Use lubrication to mimic real skin contact and reduce friction. Slow down and focus on sensation, not just release. Avoid rushing or squeezing too tightly. Think gentle, mindful, relaxed. When possible, integrate emotional connection or fantasy to engage both mind and body. This isn't about guilt. Masturbation, when done with care, can be a healthy part of your routine, supporting circulation, hormone health, and self-awareness. But you must treat it like what it is. Practice for real. Intimacy. And like all practice, it works best when it reflects the experience you want to have. Never smoke and start moving. Again, I've said it before, and I'll keep saying it until it sticks. If you care about your erections, quit smoking today. In my 4 decades as a urologist, I have seen more men lose their sexual function to cigarettes than to any other habit. And not just older men, middle-aged, newly retired, even fitness-minded guys who eat well and take supplements, but still cling to those daily smokes. One man, a 66-year-old Navy mechanic, summed it up perfectly. "I gave up beer, I gave up steak, but these damn cigarettes feel like my last comfort." That comfort was killing his erections. Cigarette smoke causes vasoconstriction. It narrows blood vessels and hardens arteries. And remember, your penis is basically a blood vessel system. No blood flow, no erection. It's that simple. His testosterone was low, his erections weak, his confidence gone. We ran the numbers, and the damage was clear. High cholesterol, narrowed arteries, poor circulation. But here's the hopeful part. When he finally quit smoking and began walking 30 minutes a day, his energy returned. His erections improved. His mood lifted. And his partner noticed, not just physically but emotionally. So what should you do? Quit smoking, cold turkey, patches, hypnosis, support groups, medication, whatever it takes. Start moving. A brisk daily walk is enough to improve blood flow, increase testosterone, and boost mood. Add light resistance training 2 to 3 times a week to maintain strength and hormone balance. This isn't about running marathons or getting six-pack abs. It's about giving your body a fighting chance to heal. It's never too late. The body is remarkably resilient, especially when you show it you're ready to care again. Never shame yourself for performance issues. You're not broken, you're too human. If I could remove one invisible burden from every older man I meet, it would be the quiet, crushing weight of shame. So many men come to my office, not just with medical concerns, but with eyes downcast, voices hesitant, as if their bodies' changes have stripped away their identity. They don't say it outright, but you can feel it in the silence. I don't feel like a man anymore. One of the strongest men I ever knew, a retired firefighter, in his 70s, told me he felt more fear facing his wife in the bedroom than he ever felt running into burning buildings. And that broke my heart. What most men don't realize is that sexual function is tied as much to the mind and heart as it is to the body. One bad experience becomes self-doubt. That doubt becomes tension. The tension leads to more dysfunction. And so the spiral begins. But here's the truth. You are not broken. You are not weak. You are evolving. Aging brings changes. Yes, blood flow may slow. Hormones dip. But these are not failures. They're transitions. And every transition invites growth, not defeat. What matters is how you respond. Talk to your partner. Let them in. Most want connection more than performance. Consider counseling, especially if anxiety, guilt, or shame are getting in the way. Change your inner narrative. Your value is not measured by what happens between the sheets. When you replace judgment with curiosity, performance with presence, and fear with compassion, you unlock a different kind of intimacy. One that may be even richer than what youth offered. Your body deserves patience, and so do you. 10. Never stop having erections altogether. Use it or lose it. Is real, of all the advice I could give men over 60, this one might be the most surprising and the most important. Don't stop having erections, even if you're not sexually active, even if you're not in the mood. Here's why. Erections aren't just about sex. They're about oxygenation, tissue health, and hormonal rhythm. When the penis fills with blood, it brings oxygen to the delicate tissue, keeping it elastic, functional, and responsive. When erections become rare or disappear completely, that tissue begins to fibrose, harden, blood flow reduces, and shrinkage becomes real and measurable. Yes, penile atrophy is a clinical reality, and it happens quietly when erections stop happening. Even spontaneous nocturnal erections, those that occur during REM sleep, are part of the body's maintenance system. When they stop, the whole sexual system slows down. I've worked with many men who went a year or more without any erections. Some had lost partners. Some simply thought, I'm too old for this. But when they wanted to return to intimacy, physically or emotionally, it was a steep, sometimes irreversible climb. So how do you stay active? Solo stimulation, if partnered sex isn't part of your life, is absolutely valid. Work on circulation. Walking, stretching, pelvic floor exercises. Address any medical blockers, low testosterone, diabetes, high blood pressure, with your doctor. Don't think of this as vanity. Think of it as basic maintenance, like running the engine once a week to keep a car from stalling. You're not keeping your erections for anyone else. You're keeping them for you, for your sense of vitality, identity, and connection to your own body. Conclusion. This is not the end. It's a new beginning. If you've made it to this point, I want to say something not as a doctor, but as a man who's walked beside thousands of others just like you. You're not alone. And you're not too late. Not for health, not for intimacy, not for healing. You've just read through 10 of the most important truths I've learned in over 40 years of caring for men after 60. Truths most of us were never taught, never encouraged to speak about, and too often ashamed to confront. But let me be absolutely clear. Taking care of your penis is not about vanity. It's about listening to your body, honoring your history, and protecting your future. We've talked about how your erections are messengers, how desperate fixes can backfire, how hygiene, movement, and emotional self-respect are just as vital as any medication. We've talked about the harm of silence, the danger of shame, and the power of mindful connection. And we've talked about this: use it or lose it, not just a phrase, a biological law. So what will you do now? Will you keep pushing it off, telling yourself it's just age? Or will you start today, right now, with one small act of courage? Call your doctor. Go for a walk. Have the difficult conversation. Reframe how you see yourself, not as someone losing something, but as someone gaining the wisdom to care for what matters most. Because the truth is, your best years are not behind you. They're just waiting for you to show up for them, with honesty, curiosity, and commitment. And if this message spoke to you, even just one part of it, give it a like, share it with someone who needs to hear it. Leave a comment below if you have a question, a story, or even just to say I'm here. And most importantly, subscribe to this channel. We're building a community where older men can talk about real things: health, sex, aging, pride, without shame, without judgment, and without silence. This space is for you, and I'm honored to be in it with you.